Well, hello everyone. My name is Dr. Alexis Faison, and I am a licensed therapist as well as a professor. And I'm excited to be here with you all today to talk about therapy and to have a conversation with Lakeisha about therapy and medication and how the two work together and can be a beautiful collaboration. Um, I am a professor at ASU, and I also work in a part time private practice. And I really do love being able to talk to my students about the work that I do in the community and the work that I do with my clients. I feel like it's really important. I teach in a counseling program. So to be able to show them the skills that I've honed and developed in my clinical work and to bring in real lived experience, I think super helpful. And then for my clients, I primarily serve BIPOC populations, primarily Black women specifically. And it's an honor and a privilege to be able to help individuals on their journey. And I'll be talking a little bit today about what therapy actually is and entails, especially for clients that have misconceptions about what it is. I know there's a lot of stigma in our community sometimes about therapy. So we're hoping to debunk some of those myths today and just have conversation. I mean, especially as two Black women, we understand, what our clients and what people, the hesitations sometimes when it comes to medication, when it comes to even coming to therapy. So we're hoping to create a space where we can have those conversations and hopefully plant seeds for individuals who may be interested in exploring either of the two or both, possibly.
Thank you for sharing.
Yeah.
My name is Lakeisha Appleton. I am the founder and lead clinician here at Ada Psychiatry. I am board certified in family medicine and family psychiatry. Family medicine originally was my first route of journey in my nurse practitioner role. I practiced in that many years, 6 to be exact. And then I went back to school and I got board certified in psychiatry and decided to open up my private practice to be able to help the community with mental health challenges, especially after COVID. I love what I do here. I'm located in Arizona. I also see clients in Washington and New Mexico virtually. My goal is to be able to expand nationwide one day so that everyone can get a little bit piece of ADA. That's the goal. I am doing this with Dr. Alexis to bring awareness. I find that a lot of us continue to mask throughout life and have challenges, whether whatever part of life that we're in. And it's really important to be able to be educated, learn more about your mental health, whether you're not struggling significantly, but just everyday tasks, executive function, how to be productive in life. And that's the goal of this. And we plan on having more in the future on different topics. I love her when she says just learning how to thrive. How to thrive in life is so important and very crucial. And being able to have such a friend to be in this journey together, share so many different similar experience to reach out to many women and men, especially of color, and so that we can decrease segmentation, have people come out, share their stories, have people be heard. We're just doing everything for our community and outside of our communities, different ages, populations from children, adolescents, geriatrics, adults, whoever needs it. Very important. I'm so glad to be here.
Yes.
This is amazing. This is our first webinar together, and I just want to say thank you for joining me. And I hope you all learned something meaningful today.
Yes, yes. I always welcome the collaboration, Lakeisha. And I feel like, that's what, for me, I feel like I always talk about collaboration in therapy and like having community, having a support system. But I also feel like just, as women doing the work out here, we need support for each other. Right?
Mhm.
I'm so happy to once again be here with you today and have open conversation about therapy and medication and talk about the work that we do with our clients day to day. Yeah.
Thank you. You can go ahead and get started and take it away.
Yeah, so I guess to start us off today, I wanted to talk about what therapy is. And the reality is, I know for many of you, you're like, well, that's so simple, Alexis. Like many of us know what therapy is already. But I want to talk about the work that I do as a counselor. And when I meet with a client for the first time, I always start off by asking, what brings them in and kind of what they're looking for in terms of what type of support they're looking for. Because I think there's a lot of misconceptions about therapy being just talk therapy or being just advice giving, when the reality is, I don't do either exclusively. It isn't just talking and it isn't about giving advice, because I tell clients all the time, they are the experts in their lived experience. I'm just fortunate enough to be able to walk alongside you on said journey, maybe your journey of healing, your journey on growing. But generally speaking, I kind of can break down therapy for those of you that may be interested in exploring what therapy is. I like to always start out with kind of what's most concerning. Like I like to think about like what's causing maybe distress in your life, what has been a current event or something that has maybe triggered your desire to explore therapy options for yourself. And as a therapist, one of the things I think we don't talk about enough is really, what are you hoping to get out of our time together? I constantly am checking in with my clients about what it is they are here for and if we're actually working towards said goals. Because sometimes I feel like, we could do this cycle, this song and dance. And I feel like it's really important to be intentional with your time and to be and have goals, to have therapeutic like treatment planning goals to help you know that we're working on this journey together and that you and I see the same thing as being helpful. Because I feel like it's really important. I tell clients all the time that you all have agency and voice and being able to tell us that, hey, I don't feel like what we're doing here is actually helping, or I maybe find it beneficial if we focus on X, Y, and Z. So I'll share a few misconceptions that I hear often about therapy, such as therapy is only for people that have serious mental illness. And that is not true. Like therapy is for a wide range of needs and concerns, that doesn't have to be serious mental illness. It could be everyday life stressors. And I'll be honest, that could be from having a long commute. It can be from parenting stress. It could be from a whole host of things like stress on the job, relationship stress. And it could be obviously deeper wounds than that too. But it isn't just for individuals that have serious mental illness. It's for all of us. And I'll be honest and transparent in telling you that I have a therapist. I see her every 2 weeks and I love our time together, right? Because even as a helper myself, I know that I need support too. And then one of the other things that I often talk to clients about is, this idea, especially in our community, the Black community, of feeling like therapy makes me weak. Like if I go to therapy, it means that I'm weak. It means that I'm not strong enough to handle everything. My parents didn't go to therapy. We just pray about it. And trust me, I'm a pastor's kid. So I believe in prayer. Okay. I believe in prayer and I believe in therapy. There's actually these cute shirts that's like prayer and therapy, Jesus and therapy, because I know I need both, and once again, depending on your lived experience, your culture, it's important to understand that therapy doesn't mean that you're weak. Therapy means that you have maybe self-awareness or you're wanting to be more self-aware. It means that I think it's a sign of courage and bravery to talk to a stranger and to open up and to be vulnerable and to build a relationship with your therapist. So I hope that we're able to start reframing that mindset that therapy means that you have to be weak or that something has to be extremely wrong with you, when the reality is, I tell every client that I meet with that you've taken a step on your healing journey. Like that means that you're ready to like improve your quality of life, to better your lived experience. So those are just some things that I wanted to share just right off the jump when it comes to kind of what therapy is, some of those misconceptions. And then, a client the other day called for a consult and was like, how do I know, therapy is the right fit for me? And, there's a few things that I asked this client, this potential client, of like, okay, obviously talk to me about what you're currently experiencing. And if you're feeling stuck, if you're feeling overwhelmed, if you're feeling like I've had more bad days than not, and I have nowhere else to really turn, or I'm not leaning on anyone, then maybe this could be a good fit. Maybe therapy could be helpful. If you're navigating major life transitions or major losses in life, Like I know, Lakeisha, you talked about COVID-19, but I'm working with so many clients that we're still talking about grief of everything that was lost during that period, and not just loved ones and time and experiences, but just the kind of ripple effect of what's happened since the world kind of shut down and us now kind of, coming back to some sense of normalcy. So I'll just say that of like really think about your lived experience, think about your quality of life, your satisfaction with life. There's a few like measures and questionnaires I'll use with clients sometimes to really understand and get at certain factors of like quality of life and satisfaction of life. And I don't think that's something we sit down to really ask ourselves. Am I satisfied with my life right now? Am I good with where I'm at with things right now? Am I, do I feel like I have a pretty decent quality of life? And those are questions that I ask my clients most days of like, what are we doing to get to a better place? So that is kind of what I'll kind of start us off with, and something to kind of sit with and thinking about what therapy is. And one more piece I'll just add is that I believe it truly is about collaboration. I said it earlier that my clients are the experts in their lived experience, right? So they have to come in willing and wanting to engage, which is why I always kind of, assess for whether readiness for change, readiness to come to therapy, to begin work, because not everyone is ready. And I respect that. Okay. Like this isn't a judgment thing. It's just let's be honest with ourselves for a moment of like, am I truly ready to sit across the room from someone or virtually? Because I will see my clients virtually, but am I ready for that? And the reality is, maybe there are some steps we need to take before we're truly ready to open up fully or have the capacity for that. But I think it's a question that only you can answer when it comes to, are you ready to engage in this step? And then are you ready to vet who it is you will be, choosing as your counselor? Because any client that calls me, I say I recommend you also call other counselors just to see if there's someone that could be a better fit for you. Because I want to make sure that you are with a therapist that's the best fit for you. So there is nothing wrong with interviewing your counselors and your psychiatrists to make sure it's a good fit for you. So those are some thoughts that I have.
Thank you for sharing. I
Yeah.
do want to echo the fact of therapists having therapists. And I think us on the medication management side, psychiatrists, psychiatric nurse practitioners, physician assistants, we should also have therapists. It's when
Mm-hmm.
we work in mental health, it is a lot. We are trying to help people improve and make them feel better. And obviously, we're still humans at the end of the day. We still have our challenges, we still go through things. And it's really good to be able to have a positive outlet where we can be able to explore some of the emotions and the feelings that we have inside to our own personal therapist. Not just bringing it home to our spouse or
Right.
talking to our friends about it, but someone in a professional manner so that they can continue to help ground us in the moment. Because one of the things that I've learned when I was in school is countertransference. Very important to not be able to displace that. And what that is just taking your own personal experiences and transferring it on your clients and making it more personal. Yes, you should have a therapeutic relationship. Yes, your relationship should be very empathetic, but we too have to display very important boundaries.
Mm-hmm.
What I am going to talk about in my role and goals today is discussing the psychotropic world, understanding medications, what they do, how do they help, what are the fears in starting medications, and helping you understand that how therapy and medications together can improve symptoms overall. And there's a lot of studies out there that shows that it is the best evidence that when you have a collaboration effect, you
Mm-hmm.
can heal faster and quicker. All
Yeah.
right, let's get into it. So, what are psychotropics? Psychotropics are medications that are essentials for treatment. They're designed exactly to help us restore our chemical balance in the brain. Our brain relies on neurotransmitters. I know you all heard about serotonin and dopamine. But we have other transmitters as well. We have norepinephrine and we have GABA. These neurotransmitters play a huge critical role in helping regulating our thoughts, our memories, the way we make decisions, our mood, our anger, and our sleep. So just imagine if our transmitters is not fully balanced correctly, we can end up on so many different types of signs and symptoms, especially when it's exaggerated by stress.
Mhm.
Medications such as antidepressants, anti-anxiety, sleep aids, stimulants, antipsychotics, they work by enhancing or slowing down how those brain chemicals function. So we're either going to take a medication that's going to give us more, like serotonin, make us more happier, or we're going to take something to stop the neurotransmitters because it's too much in our brain, like something if we have anxiety. The
Mhm.
goal is to help manage these conditions so that me, you, and everyone else can have a better quality in life. Medication plays a huge role in managing symptoms. It is important because let me just tell you, when you are struggling with your mental health, it can be hard to show up for yourself, show up for others, be a parent, be a sibling, be a daughter. It's hard because you are constantly in this fight. Have you ever heard about masking? Because we all do it, myself including.
Oh, yeah.
And what that looks like is that I get up for the day, I'm out the door, and I have to present myself in a certain type of way,
Mhm.
right? Mask goes on. Professional, getting through it, seeing my clients. But once I'm done for the day and I'm checked out of work, that mask goes off
Mhm.
and the reality sets in,
Mhm.
whether that's stress, trying to balance how to be a mom, a
Yeah.
wife, a
Yeah.
business owner,
Yeah.
manage a client load, like all of these different things.
Yeah.
And yeah, stress can cause anxiety. There can be problems with executive function where there's difficulty focusing and feeling like you aren't organized because there's just not enough time a day.
Yeah.
So, what I remind myself daily on a constant basis is how to show up for myself.
Yeah.
When you're struggling with your mental health, it can be hard to. You can feel debilitated. Your mind can be saying one thing, but your heart can be saying another.
Yeah.
Every day you can say, I'm going to get to the gym. It's on my plans. This is the goal. But when that day comes and you wake up in the morning, you're stuck in bed and your plans fail. And what happened when it fails? You feel like a failure. You
Mhm.
feel irritable. Well, why can't I just do the things that I say I want to do? And this is why it's important to identify triggers, identify reasoning, understanding mental well being, and how important it is, and what type of vital role that it plays in our lives every day.
Mhm. Yeah.
With medications, sometimes it can be short term, sometimes it can be long term. I often tell my clients that they're little mini helpers. And they sound just like that because when you hear medications, you hear something big like, whoa, that's a big step. Like therapy is cool. I don't have to do nothing. I show up, I listen, I journal, I get feedback, I do my worksheets, we're done.
Yeah.
But medications, I got to take a pill every day. I have to remember how to take it. I'm thinking about the side effects to it. Will it work for me? Is this the right treatment? I mean, there's just so many different emotions that involves and goes into that.
Mhm.
But they're just like exactly how they sound, and that's many helpers.
Mhm.
They're there to support you through your day and help you get through your week.
Yeah.
For some conditions like depression, anxiety, medication can be used temporarily. And there's others like psychosis and addiction, is even schizophrenia, where they are lifelong tools. And without them, you can't function. There's no balance. So you need them on a continuous basis. The goal, obviously, is to not just to rely on medications, but to use it as a comprehensive, a treatment approach to your mental health. Because what I tell my clients is that we can take medication. We can help it improve your symptoms. You can feel better within 2 to 4 weeks. But have you changed your environment? Have you identified your triggers? Are you journaling when those emotions get deep? Because medications can't do it alone.
Right. Right.
They're just the mini helper. So we need other aspects in that comprehensive approach to be able to make things better. And Dr. Alexis will discuss the benefits of like adding therapy and what that looks like to a comprehensive treatment plans.
Hmm. Yeah. And I'll just say, Lakeisha, I appreciate you naming, like talking about the masking and even bringing
Mhm.
up that, therapy, like the medication, like it can't just be a reliance on that. And sometimes with therapy, like you need the medication piece too, right? And something that you said I wanted to go back to, and I think it was about the masking of like when we go to work, like we put on a mask and people say, "How are you doing?" I think all of us have said I'm fine before, right? And have not
Yes.
actually been fine. And, one of the things I've been reflecting on lately is like, how do we show up authentically? And like, how do I show up as my true self and actually name, like when someone asks me how I'm doing and I say I'm tired, or I say, yeah, I didn't sleep well last night, or say, you know what, it's been actually rough with my kiddo at home where we're going through a regression, a sleep regression, or, or whatever. And like naming my truth and not masking so much because I feel like it almost puts shame to it of like, no, that's too much. Like what I'm going through, like no one else needs to know that. I don't need to burden anyone
Mhm.
else with my stuff. When the reality is, you'll find that if you actually name and speak your truth, you'll find that so many people can resonate with it and may also agree with you and may also support you and say, you know what? I got this. Let me help you with this. Or I didn't know that you were going through that. Thank you for sharing that with me. And it just can be a connection point versus this need to conceal and hide. And I think I often talk to the clients I work with, especially Black women, about kind of like this superwoman, complex and syndrome of like feeling like we have to be everything to everyone but ourselves and that we can do everything and do it all when the reality is we weren't built to do it all, nor do we have to. Like, that is why we have community. That is why we have, and if we don't have community, I tell clients all the time that sometimes that's the thing in itself of like, you need people that are safe, that you trust in your circle and kind of building that. So I'll just say another piece too about therapy. Therapy isn't about just the 50 minutes to an hour that I meet with a client every week or bi-weekly. I meet with some clients every 2 weeks, some clients once a month. So I want you to think about how much life you're living outside of the time that I'm fortunate enough to sit across from you, right? And that means that it takes work. So I tell any client that feels like, oh, they're just going to come to me every week and they're going to get their dose of, I'm here in therapy, I'm going to talk things out and then I'm going to be good. If they think that's the reality, I'm sorry to
Mhm.
tell you, it's more than that. Because it means that you have to then take what we've talked about that week and apply it and actually put it into your life and actually do the things and actually practice on setting boundaries and practice doing whatever, the journaling, practice, being assertive in the workplace and saying what you want to say and saying what you mean and, not taking on other people's stuff. You know what I mean? So I want us to be mindful of that, of like therapy isn't just about coming into an office for once a week and talking, about your problems. It's about doing the work outside of it too, retraining our brains, unlearning habits. I talk about that so much of like, we have to do the work of retraining our brains. And as someone that identifies as more of like a CBT, a cognitive behavioral therapy therapist, I talk about unlearning messages and retraining our brain and being really intentional with what our brain and our mind is telling us and how that impacts our emotions, how that impacts our behaviors. So that's kind of food for thought. So when we talk about the integration piece, this is the part that I love the most because oftentimes in therapy, when clients will say, Alexis, I'm feeling still stuck. Like it's impacting my ability to show up at work, it's impacting my ability to show up for my kids and my family. And then we have the medication conversation. And this is why I love connecting with Lakeisha and being able to have conversations with her too about different medications and different supports for my clients. But, we'll have a conversation about how do you feel? about considering medication and talking to a provider that can go in depth more about medication options for you. And I'll be honest, this is one of those like, it's a mix 50-50, depending on the client, right? Because I think there is still a lot of stigma about, well, I don't want to be on another medication. I don't want to have to be tied to something. And we'll talk about some of those myths in a few and maybe some questions people have, but feeling like they're going to be taking a medication for the rest of their life, feeling like this means that they do have a serious problem. Like if I have to take medication, that means that I'm foregone. Like something has to be wrong with me. Like really, right? Like this must be more serious than I thought. I thought it was just anxiety, which I'm like, anxiety, it's more complex than I think we like to talk about. Like I think we use it in such lay terms. We all, a lot of us say like, oh, I'm anxious, I have anxiety. I think we see it so much on TV these days that, we just feel like it's, but it's more debilitating. Like all of our anxiety looks different. I like to say we all have some anxiety, right? Because I think that's just a natural function that occurs. Like you think about like test anxiety or just driving on the road sometimes when it's like traffic, traffic time and busy on the road, you may feel a little nervous or flying or whatever, right? You may feel a little anxious. But when we talk about generalized anxiety disorder, and we talk about social anxiety and we talk about other forms of, phobias and so forth, it goes beyond that, right? And it is at times debilitating and impacts, going back to quality of life, it impacts our quality of life. So while I may work with a client on retraining their brain, on kind of engaging in maybe some stop logs and thought logs and things of that nature and journaling, it may require medication at times. So, we have an honest conversation about trying it, on their openness to it, on taking baby steps by having the conversation with the provider, by me connecting them with someone, because once again, that's out of my scope as a therapist. So it's really important that, individuals understand kind of what our lanes are. Because I remember I had a client one time that was like, can you prescribe me something? And I was like, yeah, all I can prescribe you is some homework and some stuff for you to think about and some reflection and, and I can assign you to reach out to a provider who can help you with medication, because that isn't in my wheelhouse. But the conversations matter. And something I want to talk to Lakeisha about is how often you kind of collaborate with therapists. So I know you are like a unicorn in a lot of ways because you do both therapy with your clients and you focus on med management too. But I know that there are a lot of psychiatrists that do not, that primarily meet with their clients for 15 minutes and it is just a med check visit. You know what I mean? So really thinking of like, what would you tell clients and individuals that are interested in exploring the options and what to look out for when it comes to that? Because I think there's a lot of kind of misconception, because I've had clients tell me that they barely saw me. They didn't ask me anything. They only asked me a few questions and then prescribed me something, and it's like, how do you navigate that? Yeah.
You are right. There's a lot of med management providers that um, solely focus on medications and seeing how people are doing, if they're having side effects, if the medication is even effective. And then when they have things where maybe they need cognitive behavioral, grief therapy, trauma-focused therapy, EDMR, family system therapies, they will refer out to a therapist. My practice is a little different because I like to listen to my clients. I like to show up, and I just cannot do the job just by prescribing medications. I'm knowing who your dog is, their name, your last
Yeah.
vacation, your favorite color, where you were born, what you like to do. We talk about hobbies, personal goals. I do life coaches. Where do you see yourself in the next 5 months? Okay, you want to work on and build credit? Let's focus on that.
Mhm.
And so I try to incorporate a lot of stuff because, like you've mentioned, yes, medications I can prescribe, but if we're not identifying the main cause, medication will not be fully effective.
Mm.
I do collaborate with a few therapists near my office. I have a few that I've met personally and went to their practices and met the team that I like, and I read reviews. I send my clients there. I follow up with my clients to see how is it going? Are you getting a good experience? Because if I refer out to a therapist, that means the expectations should be Shapar because I
Mhm.
give 5-star service. So I want my clients to be able to give that 5-star service.
Yeah.
And it's important. I do outsource for like trauma focus, EDMR, grief therapy, adolescence therapy, family therapy, marriage counseling.
Hmm.
But if it's like psychotherapy, cognitive behavioral therapy, I work with my clients on how to retrain negative distortions,
Hmm.
self-esteem, building up confidence,
Yeah.
identifying triggers. We journal. That's like the first step is to identify.
Right.
And my tagline here at Ada Psychiatry is choose empowerment. I think it is very vital that clients know what that means. I'm not here to hold your hand. I'm here to encourage you to learn about your mental health, to speak up to yourself, to voice your opinions. If I say, hey, let's take A,
Yeah.
and you just say, okay, but you have questions about it and you're concerned, and you go home, you pick up the prescription, you never take it because you never wanted to in the first place.
Right.
That's not how we operate here. We talk about it. I ask, hey, are there any fears you have?
Hmm.
What do you think about an anti-anxiety medication? Or what do you think about a sleep medication? How would you feel if you have to take something? And if they start explaining to me about their fears of side effects or needing to take something, so let's talk about it.
Right.
And I try to answer those questions because, again, if you recommend something and they don't take it, they're not going to get well and they don't benefit from it at
Right.
the end of the day. And you never even known if they've taken it already.
Yes.
They
Yeah.
show up in 4 weeks and they're still the same, or if not worse.
Yeah.
They've had anxiety about it. They've had 2 mild side effects. They're like, nope, I'm done.
Yeah. Yeah.
That's it.
Yep. Or I've noticed that they expect it to work instantaneously. And I'm
Hmm.
like, y'all, it takes, I just say a good 4 weeks. I say you got to give it a month. I know you say 2 to 4 weeks,
Yes.
but I honestly feel like a month of consistency, like you have to really be consistent with it. And what I've found and what I noticed when I ask clients, because as a therapist, I think it is super important that we are asking our clients, how's your med management? Like, are you taking your medications as prescribed? Because when you'll be surprised when you ask that question specifically, are you taking your meds as prescribed? You will hear different answers of I cut it in half. I take it every other day. No, this doesn't make me feel good. Oh, I'm constipated with this. Oh, I don't like this. And I'm like, okay, have you told your provider that? No, no, I'm just gonna do it, do it my way. And I say, let's think about that. Okay. They've told you to take it a certain way. And even if you are having side effects, it's like, how do we empower them to start naming it? So I agree with you on the empowerment piece of like, I tell clients all the time, like, use your voice. Like, if you don't feel comfortable on something, then let's name that and let's tell your provider that you want to be switched to another medication for these reasons and document them of like I've been taking it for this long and I've noticed this and this. I've never had these symptoms before, but these are side effects and I don't feel comfortable taking this any further, and what else can I take that wouldn't give, you know what I mean? So
Hmm.
being able
Yeah.
to have those conversations and to document that. So I do empower clients to do that. So I'm glad to hear that you're having those conversations with your clients. So your clients are lucky because I know that not all, just like not all therapists are created equal, not all psychiatrists are
Hmm.
created equal either. So that's why I think it is so important, y'all, that you find therapists, psychiatrists, providers in general that are going to be good fits for you, that actually listen to you and care about your whole self. Like, yes, I care about my clients' mental health, but I care about our physical health, their sleep quality, like all the things like I care about too, because I know how important that is also to the mind and the body in general. So I'm glad to hear you're also having the same intentional conversations with your clients. Yeah.
Right. I do want to talk about psychotropics and the different type of medications out there. Now, there's a lot, but we're just going down to the basics and naming a few common classifications that you all may have seen, read, heard about, or maybe even taking. Antidepressants. These are medications that are used to treat depression. The goal of treatment is to improve the way you feel, prevent suicidal thoughts, negative thinking, sleep quality, and overall mood. I will say with depression, it looks different in everyone. Most people think those who are depressed are the ones who are crying, they are isolated, but it can look like in someone who is also happy because they mask. But when that mask go off and they're alone in a quiet space and in a quiet environment, those negative thoughts starts coming down on them.
Mhm.
Feeling like a failure, not having motivation, unable to get out of bed, sometimes not being able to shower, isolating themselves from the world, friends, family, spouse, children, not taking up in personal interests of the things that they used to love and or what they used to do. I love to play pickleball, but I've noticed the past couple of months I just can't do it anymore. I don't have any interest in putting on my gear and going out and doing the event. Those are common signs of depression. Analytics. These medications are used to treat anxiety and panic disorder. They work by reducing that fight and flight response that people may physically feel when they're anxious or they're having a panic attack. I common have fight and flight mode. Like it's something that you don't want to feel. It's like your heart rate goes up, you're hyperventilating, your palms get sweaty, you get anxious. I have situational anxiety, so like in stressful or intensive moments, I can get a little bit anxious. And that's when I use my deep breathing techniques. Maybe I try to do refocus imagery to help calm myself down. But for those who anxiety is debilitating, where they're having panic attacks driving, they're having road rage, they have to pull out on the side of the road, they can't get up and go to work every day because they're anxious. Some people can't even leave their home. Some
Yeah.
people have phobias. I mean, there's so many different type of anxiety, OCD that leads to anxiety, body dysmorphia. I mean, I can just name a slew. You have trauma that causes anxiety,
Mhm.
substance abuse, drinking alcohol, smoking cannabis, doing drugs, having just recreational toxins in your system can cause anxiety. Analytics do help improve that fight and flight response so you can take a deep breath and feel calm when it does arise. Antipsychotics. This is a big name. It sounds scary and it's big. Oh, you're telling me I need to take a antipsychotic? These medications are used to help reduce hallucinations, delusions, disorganized thinking, mood swings, anger, treatment resistant depression, and sometimes antipsychotics can be on a long term basis. For people who experience psychosis, schizophrenia, bipolar disorder, depression with suicidal thoughts or psychosis, they may have to take these treatments. And then you have sedatives for my people who can't sleep. It would be nice if you just lay down at nighttime, close your eyes,
Right.
brain shuts off, and you go to bed, you get 8 to 9 hours of sleep, you wake up, you feel rejuvenated.
Mhm.
But you have people out there that have true sleep disorders, insomnia. And insomnia can be caused by medical things, it can be caused by mental health conditions, and sedatives help people improve their sleep. It provides muscle relaxation and then also give you that sense of calmness so that you can be able to get rest. And then there's stimulants. We all hear about stimulants, Adderall, Vyvanse. I love specializing in ADHD
Mhm.
because when you know someone who is neurodivergent and they come to you as an adult because they've never been evaluated and they've never been treated for ADHD in their entire lives, and you can see the detrimental that it causes on their relationships,
Mhm.
their job performance, their overall productivity. And when they start medications, you can just see them improve and enhance. And the one thing that my clients always tell me, I wish I would have done this a long time ago.
Yeah.
It feels so good to finally feel normal.
Yeah.
When you have true ADHD, it can be debilitating. And I specializes in it. It is my favorite niche. I work with business owners with ADHD, children who have ADHD. A lot of my nurses have ADHD.
Mhm.
And it doesn't become a problem until you pick a career where you need help with executive function,
Yeah.
or you're going back to school for master's or your doctorate degree, your bachelor's degree, and you're like, I
Mhm.
don't understand why I can't get past one page to read.
Right.
What is wrong? What is happening?
Yeah. Yeah.
And it's just not ADHD, it's bigger than that. If it's not treated, it turns into anxiety and depression and suicidal ideations. And so stimulants are prescribed for ADHD. They work by improving your focus, your concentration, and reducing impulsivity.
Hmm. I feel like, we need that in a little graph that all the stuff you just said, Lakeisha, because I think it is so important to understand like the purpose that it serves. Because what I typically ask clients that say they've been put on a medication, oh, my doctor put me on a medication. I'll say, do you know what this medication does? I'll say, do can you name the medication? And they'll be like, I don't know the name of it. And I don't really know what it's supposed to do. I think it's supposed to help me with this. And I say, it's empowering to know what the medication is that you're taking and what it is used for. And like to understand the properties. Like, I mean, you don't have to go all into it, but just to understand at the basic level like what I'm putting in my body. Because going back to the question that we have in the chat here of how do you encourage someone to take the medication who refuses them or thinks they don't need it any longer, I think I would start with empathy. At least as a therapist, I often lead with that of like, I don't want to pressure you or make you feel pressured into taking something. So it's just acknowledging that I care about you and I've noticed changes and this may be helpful. And let's acknowledge those concerns. The concerns are valid. Okay, because I'm sure we've all heard different things about certain medications and the side effects, and we have a friend that's taken something and it didn't go well, or they've had, so it's fair for them to have maybe concerns or to not want to take something any longer, right? But it's like, can I hear that? Like, help me understand what's going on for you so that I can help you better. And then for those, like I've had a client recently say they've seen progress, so they want to stop taking their meds. They're like, oh, Alexis, I haven't had an anxiety attack in so long and I feel really good now and I don't want to take it. And I said, well, you've made so much progress. And do you think the medication helped with that? And like, let's talk about that, right? Of like how much of the medication has helped. And then what else are you doing outside of the medication to help in this environment too? And when they say, I hadn't thought about that, and they just think they can just stop taking it right away. I'm like, some medications require, and I'm sure Lakeisha can talk more about this, but require you to not just automatically stop it, but to slowly begin to, reduce the medication over time so that you don't have any major side effects just because you've discontinued, abruptly, so to speak. So I think it's a lot of things that I would do with someone in this case. And once again, really understanding their perspective and where they're coming from, and then reframing medication in general, because I like to think of it as a tool and not a crutch. I say that we can't just rely on the medication. I think you talked about this too earlier, Lakeisha. Like it's not a sign of weakness, but it's something that can help you, just like exercise helps us, just like sleep helps us. Medication can also help us, and it can help us stay grounded too, depending on what you're using this medication for, to get you at a baseline that feels good to you. And going back to normalcy, I like to always say, I don't think any of us, like we all have our own version of normal. You know what I mean? So I like to not define or tell a client that you're going to be normal or this is going to help you. I'm like, I just want you to feel at your best, like feel to where you're at a good baseline, you're at a good place where you can function and you feel your best. You know what I mean? So I feel like that's kind of what I talk to my clients about, because I really don't believe any of us, I'm like, we all are on our own kind of journeys and trajectories. So don't compare my normal to your normal. Like we may have different baselines of what that looks like for us, right? So it's not my job to judge or to say, I want you to be at my level when you have your own level of normalcy, if that makes sense to be at. So that's kind of my thoughts. I don't know. Lakeisha, what are you thinking?
Yeah, of course. So if I'm introducing medications with the client, I always look at, usually it's after their first initial psychiatric consultation, and I always look at the why I'm recommending it. Usually, if I'm recommending medication, it's because they are either in a really, really tough space or they're on their way to a tough space. And if they're skeptical, like Dr. Alexis mentioned, I always try to understand, provide empathy through that process. I let them know that you're not in this journey alone. I am in this journey with you too. I'm your number one support system. And let's talk about the fears about medication. Number one is a stigma. Are you worried what others will think if they know that you take a pill? Is it side effects? Are you worried that you're going to get side effects? Because a lot of people do go on Reddit and a lot of people do have severe side effects, unwanted side effects, unfortunately. But side effects doesn't occur in everybody. Each individual is different. Usually my approach to things is we start low, we go slow,
Mhm.
especially when they're naive to treatment. We're going to do the tiniest baby dose. And that's not to see symptom improvement, but that's just really to get your body used to and adjusted to taking something different. So
Mhm.
that's how I tailor the approach. I educate my clients. Whatever condition they're coming to me with, they're going to know what neurotransmitter is being affected, if
Mhm.
it's depleted in their brain, or if their brain is releasing too much of it. And
Mhm.
then I educate them about the medication that I'm recommending and how that medication improves those chemicals so that their symptoms can be better.
Yeah.
And then I give them expectations. I always tell them, I at least want you at a 70% of improvement.
Mm.
You'll never be at 100. But if we can get you at a 70% and we can get quality in your life, then that's a win.
Mhm.
So that's important when I'm discussing and educating them and helping them choose empowerment. Because when they come in my chair, they're empowered when they leave my door. They're knowledgeable, they're informed, and they're ready to come back. My client retention is very high. We text, we do 2-week check ins. I do frequent follow ups if needed. We do 60-minute follow ups. I really try to take the time out to listen to them and their concerns.
Mhm.
And when it's time for them to get off of medications, because I have clients who come in and they're
Yep.
ready to get off. How do I know they're ready? I
Mhm.
always ask them, how are you feeling? Has it been a 6 solid months where you didn't have any type of exacerbations? Because when you're getting off of medication, you want to make sure that you're at a higher mental level
Mhm.
as you're tapering off.
Yeah.
Just like blood pressure. If your blood pressure improves because you're taking a high blood pressure pill, well, guess what? 9 times out of 10 is because you're taking the medication. And if we remove it and discontinue it, your blood pressure will spike back.
Mhm.
Same with medications. Are you better because life is better and groovy, or are you better because the medication is actually keeping you balanced?
Mhm.
And that's tricky. And so we'll do a slowly gradual taper so that people can get off the medications. And then we see and we go from there. But before they get off, I always ask, do you have the coping skills, the techniques to be able to maintain your triggers?
Mhm.
Because what if life hits again?
Mhm.
What if you hit rock bottom again? Do
Mhm.
you have those skills to be able to climb back up to the top when it's difficult?
Yeah. Yeah.
And that's why I recommend medication and therapy together. Medication is just going to clear the balance in the brain, make you feel better. But if you don't have those techniques, it's going to be hard to maintain when you don't have medication anymore.
Right. And I'll just share, as you were talking, Lakeisha, it made me think about just the word distress in general. And you talked about when life hits again. And I always say life be life and okay. Life's for all of us in different ways and different severity levels. And I really do believe I talk about tolerance a lot, because I feel like, clients often, when they come in and say, I just want to feel better, I want to take the pain away, I often challenge it a little bit because I'm like, life isn't going to always be a safe space. And we have to be mindful of that, right? And we are going to experience the stress in our life, and we have to be able to tolerate it to where we're able to ride the wave despite, everything that's going on, right? Without being overtaken by it. So I think sometimes it's important that one of the things I do with my clients is really empower them to sit in the discomfort. Life isn't
Mhm.
always going to be comfortable. I mean, I can guarantee you, I'm sure all of us have experienced discomfort in our lifetime, right? At some point, life isn't always going to be comfortable. And when it's not comfortable, yes, I'm a big believer of different coping strategies, and we talk about them all the time. I believe in grounding techniques, I believe in mindfulness and meditation, but I also believe in just the stress tolerance and being able to grow in that and accept things that come, that may come your way without feeling like it has to break you. And I think that is often some of the work that I do with clients of like, yeah, life is life and life is challenging right now. And you can sit in it. You can. And you can go to work with it. And you can parent with it. I can't tell you how many times I feel like I've parented and had to, do all the things that I do in life. And life has been hard and it's been challenging. But so I think that's just something I wanted to name because I feel like there's a misconception that therapy is going to feel good. And it's always
Mhm.
going to be like, it's always going to be empowering and it's always going to be inspiring. And we're always going to be happy leaving therapy. And the reality is, you're not always going to be happy leaving my office. And if that's your expectation, and I can tell you right now, it's not it. It's not because I challenge my clients and because I want you to sit and reflect with certain things and to know that there is going to be some discomfort and that you will be okay and survive and move through that and grow through that and heal through that discomfort. So I just wanted to name that I'm a big proponent of medication, big proponent of therapy, but just know there's going to be some discomfort along the way. And we have to find ways to tolerate and to sit with that, the stuff that we have going on. And I see we have a question,
Yeah.
once again, regarding kind of the integration of medication. How will I know it may be time to get on medication? And is this something that patients know right away? Or does it take time with therapy, like doing therapies for some time and then realizing that therapy maybe just isn't enough for me right now? Like I need something else to find some balance in life. Yeah, good question.
Okay, I can take it away. So most of the time when I'm getting clients who are new to treatment, they've already been in therapy. So they've had therapists for over the years and they continue to have difficulties with symptoms. So they're learning their techniques and strategies of how to heal, how to get through trauma, how to be a better individual, but they're still maybe struggling with sadness, how to be happy, how to feel whole, self-confidence. And when it's to a point where it's impacting your day-to-day function and your day-to-day routine, that's when I recommend medication. And the reason for that is because if you're if you're on if you can mute for me, thank you. Okay. So if you get up every morning and you're having struggles getting out the door, your relationship is failing, not just with your partner, but with your friends, with your coworkers, you feel stuck.
Mhm.
You can't move forward. It may be time to help your chemicals get balanced. You may need a little bit more serotonin. You may need something to help with your dopamine because dopamine helps you feel good. It also helps with your executive function. And when you are on a treatment plan with me or with another provider, we measure your goals, improvements of efficacy by appointment follow ups. So, usually, what I'll do is for someone who is new, the first 2 weeks we follow up, we check in. How's it going? How are you doing? Have you started the medication? Were you able to pick it up from the pharmacy? Is it affordable for you?
Mm-hmm.
Any side effects? Has there been any life changes the past 2 weeks? And
Mm-hmm.
then we follow up at the 4 week mark because typically you start seeing some improvement around 4 to 6 weeks. And then we may do mini micro dose adjustments along the way.
Yeah.
And then once we get to that, we follow up every month until we're ready. Now, I have some clients where I see every week or every 2 weeks, and that treatment plan looks different depending on each individual.
Mm-hmm.
If I feel like we need to see each other sooner, that way there can be more close hands. Maybe there's some concerns, you're having side effects, you're uncertain, then
Yeah.
hey, you can see me sooner.
Yeah.
So that's really how we measure it, and also through screening tools. There's a lot of tools out there, AIMS assessment to see if you're having side effects with antipsychotics,
Yeah.
GAD assessment to see if your anxiety improved, PHQ-9 to see if your depression improved, adult screening for ADHD to see if your executive function improved, suicide assessment, alcohol risk assessment, all these different assessment tools. So
Mhm.
with your initial psychiatric consultation, these tools are done initially, and then they're done again at the 4 week mark and then the 8 week mark, and then that you can visualize and you can see your progress, and you'll go, okay, I may not feel it, but I'm seeing my scores improve. I'm
Yes.
seeing that something's working. I'm getting a little bit better during the day. And again, I don't expect 100%. I at least expect 70%.
Yeah. I love that. And I mean, I'll just echo that I feel like it's the same thing for therapy, like very similar in terms of at your initial assessment or the second session, I would normally, kind of set some treatment plan goals of like, what is it that you're hoping to get out of our time together, however long that may be. And really being intentional with like, okay, are these measurable? How are we going to measure this? When a client tells me they want to experience no anxiety, I tell them, nope, that's not it. Can't be it. Because no anxiety is not realistic. It's not attainable. To say that you'll never have anxiety or to say that you'll never have stress, we can reduce stress. Maybe you say that you're at an 8 out of 10 now and you want to be at a 3 out of 10 or something like that, right? And we can be finding incremental ways of kind of capturing that of where do you feel like you're at and are we noticing some decrease in certain symptoms. But I love the piece about screeners because I feel like they're useful. They're obviously your self report. So it's your ability to kind of name your experience of like, do I feel like I'm overthinking things? Do I feel like I'm able to do the things I've wanted to do over the past 2 weeks? So it's your kind of reflection and assessment to really think about, yeah, I did go back to pickleball. I have been at the gym the past few weeks. I have been eating more consistently, and whatever else the goals may have been for you that you've established. And I do love your idea about the 70% kind of as a goal that you work with your clients. I'd be curious kind of what differentiates like a 60%, like a client that was already pretty depleted and maybe at a 10% and then
Mhm.
being at a 50 and that feeling good. And it's like, I know obviously we say the goal isn't 100%, but there's a part of me that wonders what if what if that percent looks different for all of us too? Of like maybe it is a 65% or a 60%, and can that be okay for someone that was at a 10%? I like to say that's a markable improvement if that's the case. So I'd be, curious to think about that too, of like, what does that look like for the client and what's that felt experience like? Because you all are the ones that are having to live through this, right, day to day, and you want to see, right, improvement. And let's be real too, from a financial perspective, whether you're going through insurance or you're paying out of pocket, this is your time and money. So I like to say that you have an investment here, right? An investment in your health and well-being in general, right? Which is like the big picture. But from a financial perspective too, thinking about your investment, someone said the $20 do add up. Them $20 add up. Yes. Okay. And you think about this economic state that we're in right now, $20 do add up over time, or then whatever you're spending for medication. So I like to tell clients that to be super intentional with this time and this investment, and do the work that you're putting in, like, because it takes active work. I always say we cannot be passive at this. Just like in relationships, we can't be take a back seat to it driving unless you drive a Tesla that's driving automatic. You can't be a passive driver. You have to be active at it. And I think you have to be active when it comes to our mental health too.
Yes.
You have to be in the front seat of that and take charge of that. So yeah.
So I know you mentioned wanting to know, like, do the percentages differ from each individual? And yes, they do. Obviously, if someone comes in at a 20% and they're at a 65, then that's a dramatic improvement. Can we mute, please? So that's a dramatic improvement. But the reality with medication management, the goal is to always get to remission. And
Mm,
remission is when you're not having symptoms at all. So we want to get you from moderate severe depression recurrent to moderate severe depression in remission.
mm,
That's always the goal,
okay.
is to get to that remission. And I know that the other question was, is the goal to eventually get off medication? For some, yes. For other conditions, no. Some psychiatric conditions can be chronic and long term. Those that are situational and improve over time, people do get off medications. I usually recommend at least the first year to be on something to help regulate the chemicals, and that's pretty much standard by research. And then if someone wants to get off earlier than that, obviously you are an advocate in your mental health. Just because someone presents you with a treatment plan doesn't mean you have to follow it to your ability. I have patients that start and stop all the time. And I tell them it's okay because it's a learning journey.
Oh, yeah. Yeah. I love that. Yeah. And I think it is, it's okay to normalize that of like everyone's journey with medication and with therapy is going to look different. I think their clients that start and stop therapy too. They come in different seasons. They feel like they get what they need and they leave. And I'm like, something about maintenance too that matters of like, we got to make sure we can maintain this, right? And that you truly feel equipped to go out and do this on your own. That's my goal. Like, I would love to discharge my clients, right? And to be like, okay, y'all are good. We've met our goals, right? Like my job, I don't want to hoard and just keep everyone, right? And keep you for years and years. I think there are clients that benefit from long term therapy, but we can also be honest that there are some clients that benefit from short term. And I want to argue the same thing goes for medication management. Like you mentioned, there are clients that have more chronic illnesses that require them to have more long-term medication use or lifetime medication use, right? So to kind of be at their 70% or to be at their quality of life, wherever that, percentage is. And there are others that really do need it for a season in their life. And then they are able to manage and have thrive after, ending their medication journey. So I really do say I love that we're having more conversations about this, just openly. Like I hope we continue to have conversations about this because, I hope we also realize though, with more conversations, I think there comes this bit of comparison though that I'll name that when we start talking about medications of like, you're on Wellbutrin, I'm on Wellbutrin too. Oh, you take Zoloft, I take Zoloft too. When we start naming these things and, I think it's so important going back to what you talked about earlier that we all are going to have different experiences on these medications. Our bodies, our chemical balances, all of it's different. So we can't really compare to say, oh, how many milligrams you taking? How much, you take it every day. Like we can't do that and think just because we cousins and because we friends and we talking about it that
Can I try yours?
right. Like, no, that's not how this works. So I think it's important that we realize that I love the openness and the conversation that's happening, but that we realize that it's an individualized treatment plan for a reason. Like it's not meant to, you know what I mean, to really compare to other people that's taking it because their experience, their side effects are going to be different. And I only say that because I hear it a lot of like, oh, I have a friend that's taking it and she told me that she had this. And I'm like, well, you're different. Yeah. Yes. Yeah.
Yeah.
I love that too. Yes, there is beauty in that. Mm-hmm.
Someone said in the chat is the beauty in this is observing someone turning out to be great with medication and therapy and no longer on the meds. It's
Mm-hmm.
beauty.
It is. I mean, I think healing is beautiful in general. And that's why I take it so seriously and feel like we all should be on our own individual and unique healing journeys, to be better for ourselves, to be at our best, to really get to a place where we can thrive and not just be in survival mode constantly. And I've been there where it's like I am in survival mode. I'm just trying to make it to the next day. But to be at a place where you can truly thrive and just be yourself. It feels good. It feels good. It really does. And that's my goal for everyone, to be at their best and to thrive, whatever that looks like for them. Yeah.
As we are wrapping up, are there any other last minute questions?
Hmm. I second that. Life is full of adversity. It is. And at times, medications are necessary. Yeah. And yes, I second this about bouncing around to find a therapist. I said it earlier. It's so important that you do your research, that you name if you're not feeling like you're vibing with your therapist, or, I often have a conversation with my clients, especially newer clients, of like, how are we doing? How are we doing together? Are you enjoying our time together? Are there things that you want to talk about that we haven't talked about? Like, really kind of checking in and do a pulse check. And I think this is your time as a client to really advocate and to say, I'm finding it kind of difficult to open up to you, or I'm actually not feeling like I'm getting a whole lot out of our sessions. I feel like you kind of just talk about yourself. Like, I had a therapist once who would always self disclose, and it wouldn't be timely. Like, it wouldn't be therapeutic. It would just be like about her, like, girl, I've been there too. I've done that too. And I'd be like, okay, this is about me, right? This is my session. So once again, doing your due diligence to go on Psychology Today, go on Black Therapy for Girls, like going, finding different websites to find and vet therapists that are in your state, that are licensed in your state, that could be better fits. Do those free consultations if they are, doing them, just so that you can have a 15-minute conversation to ask them about their therapeutic style, to ask them about, how do they view therapy? What is their kind of, what is their specialty, like, to truly understand so that you can make sure that you find a good fit. Like, maybe it's a cultural fit, because I tell clients all the time, you know, it could be beneficial for you to have a therapist that's from your same culture, that has shared identity. Um, but maybe that's not that important to you either. When you're just looking for a therapist who is compassionate and empathetic. And while I hope all therapists are that, there's just some where you just feel more comfortable and feel like you can truly be yourself. And that is my telltale sign of, like, it is okay to say, I like this to be our last session. I appreciate the work we've done, and to have a conversation, give therapists feedback. We need feedback. Give providers feedback of, I didn't appreciate it when you did X, Y, and Z. So don't stay stuck if you feel like you could be growing somewhere else and thriving somewhere else if it's not a good fit. That's kind of my take on it. Yeah. Yeah, it's good to know early on. Okay, have that one session and be out if you know it's not a good fit. Yeah, yeah. Instead of like staying there for the sake of like not wanting to look bad, or, oh, I've already committed to her. I'm just going to stick it out because I don't want to make this person feel bad. This is about your growth and your healing. Okay, I say you have to sometimes set boundaries and sometimes do difficult things, right? Which may mean I got to say bye to this person who I don't want them to feel bad, but it's okay to give honest feedback of, I just didn't feel connected, or I was really struggling to talk to you. That's honest. Okay. So find someone that you do feel that with. Yeah. Oh, nice.
Okay.
Yeah.
I like that. Turns your life around.
Mm-hmm.
I love hearing success stories. I have so many throughout my years of 8 years of experience, and it always makes me feel good when I'm providing positivity and impactful meaning in people's lives.
Mm-hmm.
I celebrate with my clients. You did what? You passed your driver's test, you got your GED.
Yeah.
When
Yeah.
they are actually achieving the goals that we set in the very beginning and they share it with me,
Yeah.
it makes me feel happy and I celebrate with them.
Oh my God.
And
Yeah.
yeah, and when it comes to like finding the right provider, once they come through my door and they have the first conversation and they've had providers in the past, they always say, I've never had anyone like you that listened. And so I encourage psychiatric nurse practitioners, psychiatrists, physician assistants who are working in this field of mental health. Listen to your clients.
Mm,
Sometimes you don't have to have all the medical jargon that you're giving them. Sometimes they just want to listen. They want you to listen to them. They want to be heard. They want to be seen. They want to feel valued. They
mm-hmm.
want their questions answered.
Yeah.
If a client comes to me with medical jargon and resistant, bring it, let's go.
Mm-hmm.
I want to hear it. I want to hear your concerns. I don't feel a certain type of way because you're telling me what medication you want. What I do is ask you, tell me more about it.
Mm-hmm.
And why do you want this particular
Right.
medication?
Right. Be curious. Yeah.
hmm And so it's very important, guys. Be advocates for yourself. Be advocates for your family members. You might not be dealing with something today, but
Yeah.
you may be knowing someone that's close to you, a neighbor that may be dealing with something, and encourage them to speak out. Encourage them to get the help that they need, whether that's therapy or that's taking medications for the first time. We
Yeah.
never know when it's our last day on this earth, and you want to be able to spend it thriving and happy.
Mm-hmm. Yeah. So take those steps, maybe hopefully today planted some seeds, or maybe someone in your life who needs the seed planted or, could use the extra push. I'm not a big believer of pressuring people into therapy or anything, but I do say that sometimes by sharing your own experience, it could be just the thing that they needed to hear, like sharing that I really have found a therapist that I connect with. I've found a psychiatric provider who is phenomenal and actually listens and doesn't just do 15-minute sessions. She does an hour session with me and did a whole history with me and didn't just breeze me out of her office after 15. So like when you hear those things and you share that with other people, that's what they need to hear. And then also knowing that there are Black therapists out here and that there are Black providers out here that are doing this work and that can see you and that want to see you, want to hear you, want to understand your lived experiences and kind of walk alongside you on your journey too. So know that we're here. There's many of us that are out here doing this sacred work. So find one that is a good fit for you and know that you don't have to do it alone. Yeah.
Well, that's it for tonight. I think this was amazing. Thank you for joining us. Let's see, we have one more. Oh, okay, that's you saying thank you.
Yes.
Okay,
Thank
thank you for joining us. We really appreciate it. We will do more of this.
you. Yeah.
There's going to be different topics. There's so much to talk about mental health. One topic that I'm interested in is how to avoid intergenerational trauma.
Ooh, let's talk about it. That's a good one.
It
That's
is my favorite topic
yeah.
because I tell my clients, you're going to stop that cycle.
Hmm.
You're going to prevent your parents' trauma, their parents' trauma, the trauma you've experienced. You're
Yeah.
not going to cycle that into your present life. You're
Hmm.
not going to displace that on your children.
Yes. Yes. We're breaking
Really think
cycles over here. Let's
are going to break cycles. So I really think that maybe we should talk about getting a session together about trauma and how do we stop it?
yeah. Oh, that's beautiful. It's a powerful one. It's a good one. Okay, especially in this day and age when I'd say trauma
Mhm.
is all around us. There's a lot just in terms of our current climate, just in general, that can be traumatic for different communities and folks. So I look forward to the conversation though. And I thank you all. Thank you all for joining us tonight and for your wonderful questions too. Hope it was helpful.
All right, good night.
Good
Thank
night.
you.
Good night. Thank you.